exploring two important data sets used in breast cancer research. First one is breast cancer viscosum data set, and the second one is breast cancer diagnostic data set. These data sets are important in advancing our understanding of breast cancer diagnosis and enhancing the accuracy of tumor classification. Purpose of first data set is to analyze and classify tumors. Purpose of second data set is to improve detection and classification of breast tumors. Our dataset comprised of 569 samples, each with 30 numerical features that describe the characteristics of cell nuclei. And our targeted variable is diagnosis. First is malignant and second one is benign. We'll be discussing about the variables. The first two are the important variables that we have considered. One is ID number, that is unique identifier for each sample. Second one is diagnosis. This target label for each sample where M denotes malignant and B denotes benign. For the rest of the variables that are radius, it measures related to the tumor size, and texture describes the variance in pixel intensity in images. The next being parameter, the boundary measurement of the tumor, and area, which is the size of the tumor in the image. The smoothness indicates the regularity of tumor surface, and the compactness, it is a measure related to the shape and tightness of a tumor. Concavity, it describes the extent of concave parts of the tumor boundary, and we have concave points. So this is the number of concave segments. And next being symmetry, it describes how symmetric the tumor is. And there is a factorial dimension, it is a statistical measure of complexity in tumor shape.
Hello everyone, my name is Irem, and today I will explain each model and why we decided to use it. First one, logistic regression. Logistic regression is a model that works well when the data can be separated by a straight line. It's easy to understand and explain because it clearly shows which features are important. In our case, this model gave the best results, so it was a top choice. Gradation boosting. Gradation boosting is a method that builds many small models and combines them into a strong one. So it's really good at finding complex patterns that simpler models might miss. This method often gives very accurate results. Decision tree classifier. Decision tree splits the data based on features like flowcharts. It's easy to follow and understand. It's especially good at handling data that doesn't follow the straight line. Decision tree can be used on their own or as a part of bigger model like random forest. So random forest classifier. Random forest combines many decision trees to improve accuracy and reduce errors. It's particularly good at handling large datasets and showing which features are important. This model is reliable and accurate, so it's a strong choice. KNN, key nearest neighbors, doesn't assume anything about the data distribution, making it flexible. It works well. Data doesn't follow the straight line, but it can be slow with the lots of data. KNN is simple to use and understand. Naive-Bayes is a fast, efficient model that calculates probabilities. It works when the features are independent, but it still performs well even they are not. This model is often used as a starting point because it's quick and easy to implement. So now let's talk about why we choose these models. Logistic regressions, it's a simple, straightforward, and works well with the linear data. That's why it's performed the best in our analysis. Gradation boosting, this method is great for finding complex patterns and provides high accuracy, make it one of the best performers. Decision tree classifiers. Decision trees are easy to understand and good at handling data that doesn't follow the straight line. Random forest classifier. Random forest reduces errors and by averaging multiple decision trees, making it reliable and accurate. KNN is flexible and it works well with the complex data, but it can be slow with the large data sets. Naive-Bayes is fast and efficient, but making it great model to start with in any analysis. And thank you for listening. My friend will continue from here.
So, hello everyone. Today, we'll be talking about the performance of the classification models across our two datasets. So, we'll be discussing the evaluation metrics and the validation techniques that were used in our code as well as in our paper overall for the breast cancer classification. Firstly, we'll be looking at the accuracy of each model. So, that is the proportion of correctly classified samples out of the total samples. Secondly, we'll be looking at precision. This is the proportion of true positive samples out of the total samples predicted as positive. So it's the actual positives divided by the actual positives plus the predicted positives. Um, and so, yeah. Third is recall. That's the proportion of true positive samples out of the actual positive samples. So it's actual positives, it's predicted plus actual divided by actual. The fourth is F1 score, that's the harmonic mean of precision and recall. Also, we have made confusion matrices, which is a 2 by 2 matrix, which has the values for the predicted positives, the actual positives, the predicted negatives, and the actual negatives, right? We have also made precision recall curves for each model across our two data sets. So, because they show the trade off between precision and recall and how well the model is classifying the data as malignant or benign. And lastly, we used cross validation, which is a technique involving splitting the datasets into case subsets. So, if you can see on your left hand side, bottom left hand side of the screen, you would see a snippet of the code which has so we did a logistic regression model with tuned hyperparameters, wherein the accuracy of that model was 94.73%, precision was again 94.76, recall was 94.73, F1 score was 94.74, and for cross validation we had 10k. Our k was 10, so we had 10 folds wherein the data was validated across, and the mean cross validation score came out to be at 95.4%, which is like very high. So clearly logistic regression, after we tuned it with hyperparameters, which you'll see in our paper, has performed pretty well over here. Thank you. So, hi. So now we'll be discussing the performance of each classification model for the breast cancer Wisconsin dataset that we had. Now, if you see on the left, firstly we have the ROC curve, and it encompasses of true positive rate, that's the sensitivity of the data on the y-axis, and the false positive rate, that is 1 minus specificity for the given data on the x-axis. Now, as you can see on your left hand side on the ROC curve, um, logistic regression, does random forest and gradient boosting have performed like to the T. They have classified the data absolutely perfectly. They have near perfect rates. Also, KNN is quite close after hypertuning, where the area under the curve is 0.99, so 99% again. However, decision tree was didn't perform quite well, but still 94% is quite great. If we see on the other hand, on the right hand side, on the precision recall curves, we can see that for again logistic regression, random forest, gradient boosting, your logistic regression and gradient boosting are on the top again because the area under the curve is 1, so they completely classify the data correctly. Um, Again, over your decision tree sort of falls off. So our conclusion basically is that logistic regression, random forest, and gradient boosting stand out as the top performers across both the ROC and the precision recall analysis. This makes them the most reliable models for breast cancer classification in this context, providing a strong balance between accuracy, precision, and recall. But however, this is subjected to the model, if the data is added and if it's overfitting, we'll have to look into that, and that's been discussed in the paper. Thank you.
In this slide, we're looking at the performance of various machine learning models on the breast cancer diagnosis dataset. The ROC and the precision recall curves indicate that the gradient boosting, random forest, and logistic regression are the top performing models. These models achieve the highest AUC values on both curves, signifying their superior ability to distinguish between benign and malignant cases. Naive bias also performs well, but slightly lags behind the top three models. On the other hand, KNN and decision tree models show less effectiveness. The decision tree exhibiting the lowest performance across both curves. This analysis suggests that while most models can handle the classification task well, gradient boosting, random forest, and logistic regression stand out as the most reliable choices for this specific dataset. Overall model performance for both the data sets. Best performing model is random forest. Why? It provides the best balance of accuracy, precision, recall, and the F1 score with robust generalization as indicated by its high mean CV score. The least performing model in the decision tree is the decision tree. Why? Showing the lowest accuracy, F1 score, and mean CV score, its tendency to overfit and its simplicity likely contributed to its weaker performance across both datasets. Possible reasons across two datasets: random forest ensemble approach, which combines multiple decision trees, makes it less prone to overfit and more robust to variations in the data, explaining its top performance. Decision tree, in contrast, suffers from high variance and overfitting issues, which hinder its performance, particularly on diverse datasets. Overall, our breast cancer classification, random forest stands out as the most reliable and effective model, which decision tree needs improvement, while the decision tree needs improvement or alternatives, such as ensemble methods to boost its performance. Thank you.
Hi, my name is Yash, and I will be covering the implications of machine learning in breast cancer classification. Machine learning has opened new frontiers in healthcare, especially in breast cancer diagnostics. By analyzing vast amounts of data quickly, ML models can identify patterns that might elude even experienced clinicians, thus enabling earlier and potentially more accurate diagnostics. Uh, this can be critical for improving patient outcomes, as early detection is often key in breast cancer treatment. However, as we embrace this technology, several important factors need our attention. Firstly, reliability and generalization. This dependability of machine learning models is non-negotiable, especially in medical diagnostics. These models needs to be validated rigorously across diverse datasets to ensure that they perform consistently across different patient populations. Bias and fairness is our second point. A major concern is that machine learning models can unintentionally perpetuate biases found in their training data. For instance, if a model is trained on data that lacks diversity, it may not perform as well for underrepresented groups. Addressing the biases is essential to ensure equity in healthcare. Thirdly, transparency and explainability. For machine learning to gain trust is in the medical field, transparency is a key. Some models, like logistic regression, are more interpretable and thus easier for clinicians to understand. In contrast, more complex models, though potentially more accurate, may be viewed with skepticism due to their black box nature. Last point being ethical use. Ethically, machine learning should augment, not replace, human judgment in healthcare. These technologies should assist clinicians, offering insights rather than making final decisions. Moreover, patient consent and data privacy must be protected, as these models often require sensitive health information. Looking ahead, there are several research opportunities that can be explored in this field. First one being advanced feature selection, exploring techniques like recursive feature elimination, that's RFE, or PCA, could refine model accuracy by addressing issues like multicollinearity. Secondly, assemble learning, Investigating assemble methods such as random forest or gradient boosting machines may enhance model robustness by combining the strengths of multiple models. The third one being deep learning. Deep learning, particularly CNNs, shows promise for classifying breast cancer using raw image data, potentially outperforming traditional machine learning models. And the last one being model interpretability. Improving the interpretability of complex models using techniques like SSHAP or LIME is crucial for ensuring that clinicians can trust and comprehend machine learning driven decisions. Lastly, let's not forget the ethical aspects of it. First and foremost, informed consent and data privacy. Patients must provide informed consent for their data to be used, and strict adherence to privacy regulations is very essential. Secondly, avoiding over reliance. While machine learning is a powerful tool, over reliance on it without considering the clinical context could be extremely dangerous. Human oversight still remains critical. Thirdly, accountability. Healthcare providers deploying machine learning models must be accountable for the outcomes, ensuring that these tools are accurate, fair, and responsibility integrated into clinical practice. In conclusion, while machine learning offers tremendous potential to improve breast cancer classification, it must be adopted with a strong commitment to ethical principles, rigorous validation, and a focus on enhancing patient outcomes. As we continue to explore this exciting field, let's ensure that these technologies are used responsibly with the well being of patients as a top priority.